Welcome back to Dateline New Haven on WNHH-FM, New Haven's home for community radio. This half hour, we got a great guest in here. I've always wanted to get her in Dublin. I'm so happy you showed up. Dori Dumas is the president of the Greater New Haven chapter of the NAACP. She has been since 2014. A lot has happened over that time in New Haven, and she's still at the forefront of the fight for civil rights. Dori, thank you so much for coming in.
Thank you for having me, Paul.
I'm going to ask you to get so close to that microphone that you're almost touching it, but not quite.
Okay, how's that?
Good. How you been doing with COVID?
I've been doing very well with COVID. Let's knock on some wood. Personally, I have my husband. We definitely made it through. We have not had COVID, although people all around us.
Same happened to me and my wife.
Yeah,
our best friends
and
had it.
I really think that through the NAACP and the efforts we took and how serious I took it myself and tried to advocate for our community, so far we've been very fortunate. And neither of us have had COVID. Now, did it affect us? Yes. Did we see people and our families, and did we have concerns with people's health? Yes, all around us. But somehow we made it through. And the NAACP, which is one of the things we worked on before people even got out there, when we first heard about it in March of 2020, we had a town hall meeting with people like Dr. Gary Desir and others, because we already knew what kind of impact it would have on our community. So at that very early stage, we started trying to educate the community ourselves. It was new for everyone, but we knew whatever happened to the general community and the Black community, it would be.
And Dr. Desir had the early numbers on that. Am I right in saying part of that reason is because in communities of color, disproportionate number of people had jobs they had to continue going to. They were still riding the bus. They were still working in hospitals. They were still working in nursing homes. And you had more people like that. And you had homes where it was harder to separate, so then they were around older people in their homes when they got home from work.
Absolutely. Absolutely. And not to mention all of those people in our community that suffer with underlying conditions.
Right. So if you have diabetes, for instance, which is high in the minority community.
Exactly. And a lot of the people in our community did not have the luxury to work from home.
Right.
They were on the front line. Those are not necessarily the people we were celebrating, because those were the people in the stores, stocking the stores, or in the hospitals, not at the, the highest ranks. And so people that just were doing everyday jobs.
So you had to get people to take it seriously. Now, in my anecdotal observation, the Black community in New Haven was one of many communities, and Brown, that at first did not embrace the seriousness. At least among public officials and church officials, they took them a couple extra weeks.
They took a couple extra weeks.
I'm thinking of one church where they had the big event where they brought in people from Detroit and people died.
Yes.
But also genuinely founded distrust of the medical establishment about whether you can believe that's something serious. I remember people telling me early on, this doesn't get Black people because the first wave hit people in Europe and New York.
There was so much misinformation,
yeah.
So many things flying around, a lot of distrust. And it wasn't until the people, they continued having functions. And one of our very own NAACP peers, Maurice Williams, which he, openly talks about, ended up in the hospital for 40 days. And these are people right around us. So we were trying to tell people.
And it's not just the Black and brown community. It was one of numerous communities that had to, as a group.
But we were disproportionately impacted. And we knew we would be. We knew as the NAACP, our responsibility was to get out in front of it and to really take it seriously and to keep advocating, even though people weren't embracing or really listening that much at first. I think once they started seeing the impacts, more people started listening. We're still fighting that fight.
I noticed the events you held. You mentioned Dr. Desir, a number of people, doctors from Yale New Haven, to tell people this thing's for real, people they could relate to.
Yeah.
So was that the first challenge, this thing's for real?
This thing is for real. We already knew the impact it would have, and that not only would the people in our community be getting sick, but we would be dying at the highest rates, and that we needed everyone to really listen, to protect yourself, to really be smart about it, wash your hands often. We kept trying to encourage people to understand.
Masks were big. Once we learned it was about masks.
Right.
Which didn't seem to be as big a problem for people.
Right.
But the vaccine was.
Yeah, and it still continues to be.
What's up with that?
I'm really, I guess it's all the misinformation and mistrust. When I talk to people, especially that age group between 25, 35, some of the younger people, and a lot of it is that they get their information on social media, and I don't know what's going on out there. And I would say to them, tell me the real reason why you won't do it. They never have really good information. It's never
People
facts.
don't like getting stuck in the arm with something they know about.
Right, but if it's
when
going to
you look-
save your life.
I guess that's the buzz when I look at how many people who ended up getting COVID but didn't die or get that sick because they took a vaccine, and the high percentage of people who were unvaccinated, who were the ones who died and got really sick.
Absolutely.
I'm so sad when I saw that people fought so hard against.
And people continue to fight. And it's not, for us in the Black community, I know they're lifting mandates. I know that, they're opening up more. And we're saying, yes, live your life, but be smart, stay protected, stay on top of things. For our community, we always have to go the extra mile. And we know we're getting still a lot of pushback from people in our communities for whatever reason, but we won't continue. We won't stop with our efforts for advocating for safety, and for being smart.
It's interesting. NAACP, if I'm not mistaken, is the oldest civil rights organization in the country, founded by W.B. Du Bois.
Yes.
And that you played that role. A civil rights organization ended up playing an important role in public health.
Absolutely.
Is there a connection, civil rights and public health, and has it always been seen that way?
There's a connection almost with everything across the board, but certainly around health issues, around things that matter in our community. When it comes to health, there's still wide gaps with people having access to the best health, to understanding about prevention and understanding about making sure to stay on top. I mean, one of our very own, Roger Van, who did not get certain tests that he should have done, and he is using himself as a testimony of how important it is for screenings and things that affect us in our communities. At the higher rate.
I see that you're on there where I am too. He does these videos. He used to run the NAACP New Haven, and then
he's one of the reasons why I got involved with the NAACP as a very young person. So I have, deep roots with Roger and a connection. Roger and my husband went to high school together at Notre Dame. So I go back with Roger, and he took on a big position and continued to advance with the NAACP. He was on the national level. So I continue to have a relationship with Roger. But I love that unfortunately, he's going through what he's going through, but he's using his life and his experience to try to help
on Facebook
others
about getting screenings and
screenings and prevention.
One night he just got up and danced to say he's going to keep that positive attitude.
And we're fighting, and we're staying positive. But it's just, Roger's just one person and so many. Even when we're educated and know, and even when we're talking about the importance of health, we're still so far behind, and things are affecting our community at the higher rates. So as the NAACP and connecting to health, of course, that's something that we would get in front of, because our job is to advocate, especially at the grassroots level, and to keep reminding people that our lives matter, our health matters. And, and if you don't have your health, you have nothing. So we always talk about health as wealth. And the NAACP.
And we were talking about this the other night because I ran into you, Dori, at the Michelle Obama house.
Yes.
Which is on Chapel Street, which is New England's first community center and resource for sickle cell anemia, a disease that hits Black people at astronomically higher rates than anybody else.
Exactly.
And the other night we were there for an event, which I really enjoyed, about the unveiling of posters from the Black Panther era, showing that it was the Black Panthers in New Haven and Ashley who first got the country to pay attention to sickle cell anemia and have the government do wide-scale screening and education and money for care about it and searches for cures.
Yes.
And it took a civil rights group to do that. Exactly. And outside of civil rights, it wasn't the NAACP in those days, but now, James Rawlings started the group here, and he was an NAACP person. You're an NAACP person. So how did civil rights come to embrace an issue like sickle cell, and why?
Okay, well, the reason would be because sickle cell affects Black people at a higher rate, Black and brown people. It's not just a Black and brown disease, but it affects us at the higher rates. And just like anything else, in healthcare, if it's not affecting the majority, then they're not going to get the attention. They're not going to get the support. They're not going to get the funding. They're not going to get the education around it. So it's up to us. We understand the effects that sickle cell has, not just on the patient, but the entire family, and that nobody was paying attention to this. No one was putting research or dollars or money, yet people suffer every day. People were dying at 40 is the life expectancy. Even now, even though it's better, if we don't bring attention to issues like this, if we don't take it serious, who will? Because nobody was advocating for it.
What is sickle cell anemia?
Sickle cell, it's a disease of the blood. And what it does is it causes crisis. And people that have it end up suffering. And some people, like children, end up missing school. People miss jobs. And there's such a lack of education around it. And so research does not go in it. So when you talk about issues that affect people that are black and brown, like anything else, if we don't advocate, like as the NAACP and others like Sickle Cell Association, nobody is going to pay attention to the effects of it and how it is hurting so many people, and where research money, education, all of that is not going into that. So, of course, we stand up with it. The Black Panthers were the first to really bring attention to it. Even here in New Haven, a lot of the issues that were happening, when you talk about the breakfast programs, when you talk about our schools, one of the reasons why they got involved was because back in the early 70s, they didn't have toilet paper in the black schools.
Right, Hill Parents
and we
Association.
talk about these things that affect health. So those are the kinds of things that were the groups like the Black Panthers and other young, at that time, very young activists were bringing to the forefront and telling people, pay attention to this.
And the other night, I thought one of the most effective speakers was a young man who's a medical student who has sickle cell.
Yes, Frank, yes.
And so does he have a life expectancy of 40?
Well, I think because of the education around it, because he's aware of the things that he can do around his diet, around, so he's doing better. We don't, that is the general life expectancy.
I see averages are averages.
Right, that's an average. But I feel like Frank, being an advocate for himself, educating himself, really learning what triggers, his crisis, what happens with his health, and really trying to stay on top of it will help him. And his story, his testimony will help others. Because a lot of times when you're dealing in our community, it's the grassroots. It's people sharing their stories, and somebody can relate to that. And now they'll say, I need to pay attention to my health. I need to go get tested for this. I need a screening for that. I need to see my doctor more often. So it's people like Frank who we're trying to advocate for so that his life expectancy can go well beyond 40 and he can have the knowledge and understanding of how to stay healthy.
Inner City says high five, Dori. Thank you very much for listening. And so is the organization Shell House primarily about calling attention to the disease? It's also service, right, for people, families with sickle cell?
Oh, yeah. It's an advocacy across the board. So, one, they want to be able to set up where there's home infusions that can be done, that they can come to the actual Michelle's house to get services, where they can learn about how to advocate and which best doctors and how, your diet, your doctor's visits. So they're advocating for more research, for awareness, for education, for dollars so that they can support the families who then, if there are crises, educate the school system about why these students are missing school and how we can help them so they don't fall behind, and having things in place, mechanisms in place to support the families around this. Or if it's a person that has a job and they're employed and they have to be out, how you can have an understanding and how people can remove the stigma. Because people feel like people like that have sickle cell, when they're in crisis, they may be drug seeking. They don't understand that pain and that level of crisis that our sickle cell patients go through. So the Michelle's House is advocating for all of that and to bring awareness and attention at the highest levels, the nationwide, at the state level, and locally.
It was great the way history came together. Wonderful crowd.
Yes.
Love how they fixed up that house. That was a beautiful Victorian house that could have been knocked down if it hadn't been saved.
Exactly. And the NAACP has an office there. And so we're connected.
Oh, really?
Yes, we're connected.
In addition to your one on Whaley, you moved it?
Yeah, so we moved from Whaley and we are now there. We're housed there. And so we support them and we work hand in hand.
But that's a great thing. That brings full circle the whole idea of seeing public health as a civil rights issue.
Absolutely. And it is. It is. Just like education is. Just like everything that we're dealing with when we're talking about the NAACP and civil rights. So it's across the board. And health is certainly always has been and will continue to be one of our focus.
Dori Dumas, since 2014, the first female president of the Greater New Haven NAACP. We were talking last night about how you remembered the Panthers from when you were how old, living on Ashman Street?
So 5 years old, and I was in kindergarten. My mother was a single mother, 5 children. And so, of course, she was living there. And
you lived in the Elm Haven development?
Yes.
Low rises or high?
The high rises, 7th floor.
Wow.
And so,
is it true that the elevators weren't, when I used to go in there, the elevators didn't smell so nice?
Oh, they didn't. It was not good.
Yeah. We knocked those down and built Monterey. Yeah.
Absolutely. But as a young mother, that's what she could afford. That's what she could do. So when the Black Panthers came in, they had a house on Admiral Street.
Mm-hmm.
And so they started recruiting and getting people to come for the breakfast programs. So, of course, you get a hot breakfast, pancakes, and all those good things on your way to school. And so, being the mother of 5 single children, she wanted to make sure her children took advantage of that because that certainly helped her.
How long did you go there?
So, I think I can remember it for the full year.
Mm-hmm.
So, the full year. And when we would go there, what they would do is as they're feeding us, of course, we're going because there's a hot meal and we're 5. We don't know. But they're also educating us. They're teaching us positive affirmations. They're making us repeat things. So when we got there, we would have to repeat certain positive affirmations. And then while we're eating, they're engaging, they're feeding us, and then they're giving us history and talking about it. So that's the first time I knew Black was beautiful. That I mattered. Is
that something
that I valued?
And was that something you would chant? Black is beautiful.
Yes, they would have us chant that. Black is beautiful. You are beautiful. So all these positive affirmations were being taught to us daily. So as they were feeding us, they were also feeding our minds and planting seeds. And I think to this day, that's why I've always loved who I am, the skin I'm in, and I understood the value. And so I never, even though those times and these times now, people don't value this Black skin and there's racism and hate. Because of them and the seeds they planted in me and the other students, I think I carry that for life. So I've had when people would, really, you heard all the negative things on the news for history throughout the 70s. I never, even as a child, I was like, but that's not the Black Panthers I knew. That's not the people who came in our communities and uplifted us, who fed us, who really taught us and engaged and embraced us.
And you were in Wexler School then?
I was in Wexler. Well, it was called Winchester School. So I ended up, after that year, because it was rough over there, I ended up moving with my father and my grandparents the year after, and then my mother after a year, because it was a tough time in those housing developments or whatever they call them.
But it sure is nice now, Monterey.
Oh, yeah. Well, I mean, I think things have changed, and they certainly have poured in a lot more love and attention to, the
whole idea of public housing administration has kind of changed, how to do it right and how to do it well.
Yeah.
So where did you went to Hill House?
So I went to Hill House High School, was some of the best times of my life. I was always into the arts and drama club and dancing. So in those days, they would bring in, I got to dance with Alvin Ailey at Hill House High School.
Whoa,
I got to meet Jesse Jackson before the world really knew.
I remember Jesse Jackson, if I'm not mistaken, that was 1980, 79.
So I graduated in 82. So yes, he came and he lit up the school. And
he did that same idea about I am somebody. I think
am
that was
somebody.
Yeah.
Yes. And so I feel like in those days, and then they had like kings and queens. They had the daughter of Malcolm X come. So in those days, they were very connected to bringing in people to uplift the students and for us to have great experiences. So my time at James Hill House High School was awesome from day one. And between the shows we would do and the fashion shows and the talent shows.
And where did you go to college?
To Albertus Magnus.
And what kind of career did you go into?
So I actually went into economics. So that was my degree. But I always had a sense of community. So I knew whatever I did, I would be doing something in addition.
And Roger Van inspired you to come in the NAACP, and he did a whole generational change in the NAACP. You weren't the only one. That he changed the leadership with respect to the old guard, but bringing in new people.
He was the youngest in the country. Roger was in his early 20s.
I remember when he ran that against Haywood Hooks. Who was a nice man, and he was bringing a different gen. He had a whole team with him: Otis Johnson, Reverend Moss, who I'm now told is a big minister.
Oh
in
my
Chicago.
God, he's that at
Yeah.
the top of his game. So because of Roger and then the whole team he put together, I became a member. Now, I wasn't as active back then because I was a young mother. My kids were active and I was doing a lot of things, but I knew to always pay my dues every year and to support certain events. And when Roger would call on people, we always answered the call. So because of Roger, and he really let us understand the power we had and the power we could gain and the advancements we could have through working with the NAACP to hold certain.
Did you have the view that younger people had back then that the NAACP was a little too slow moving or a little too establishment, not going at the roots of society?
Before Roger, probably yes, that would be my view.
So he helped change your view of what the
He
NAACP could
definitely
do.
changed my view.
So talking about with Scott X last week, who runs the state one, that how the mission of that organization has evolved.
Yeah, the mission has evolved. It's more the mentality around because the mission remains the same. It's about advancement. It's about equality, equity. It's around fighting discrimination, racism. So those kinds of things never change. That's the fight we have. That's the fight they had. That's the fight they had when it was established, when it was founded in 1909. So our fight is still the same fight. It's just how we go about it, the things, how we engage with the community. People don't understand until they need the NAACP, right? Even our own people don't always understand until they need us or they see us. And a lot of what we do is people don't see it, right? Because we don't get media all the time. We don't get an article or the news to cover everything. But it's a volunteer organization. We put in countless hours of meeting with university presidents, with companies around here, talking to them about, let's look at your board. Let's look at who's at your top ranks. Why don't we see more black people? That's the fight. We're still fighting that fight. We still talk about the first of in 2022, where we should be having several people.
Supreme Court
we
Justice
cannot be okay with one or two, right?
So I'm looking back at some things done since 2014, first female president of the local chapter. You've as we talked about, you worked on highlighting pandemics, disparate impact.
Yep.
You were very active in police accountability discussions. You were, I think, among the people opposing the mayor's choice for police chief, partly out of
So
race.
I didn't oppose the police chief. What I opposed, I wanted to see them have what is your plan to have black people, black, brown people advance? Because when we look at the fight we had to get the first black chief, to get all these
and
things.
just to be clear, because people didn't understand this, you weren't saying the chief had to be black. You said that somebody in the higher ranks should be.
Right,
Because there's
exactly.
nobody.
I
It
was not
all
fighting
white.
against her.
But you
I
look
wanted
at
to know-
captain, you look at assistant chief. You
Yeah,
had,
and to be transparent, I had this conversation with the acting chief April of last year. So I sat down with her and I said, when we look at the makeup of your ranks, we look at the makeup of the people at the top, they're not reflecting the community. Now, she explained to me a lot of people were retiring.
But they also went backwards. There was the demotion. There were a lot of people
there was a
promoted.
lot going on.
Yeah.
But I was like, I understand that. But this is concerning, and we need to know what the plan is to change it. What is, give us the plan. So that was what I spoke out against. I was like, I'm okay, but we can't be okay without having a solid plan and commitment on how
And
you're
you
going
also
to write
did a
this.
home ownership matters program. You have a separate program for helping people, ex-offenders, reintegrate to society and get jobs. You've
Yes.
highlighted transportation.
Yes.
Getting better public transportation. You've had voter registration democracy. I'm doing that fast because we're running out of
I know,
time.
I know.
And we'll have you back for sure. Am I missing anything big here?
So currently, now that the cannabis law has passed, we are advocating for equity. Our people in our community were criminalized at the highest rates, going to jail, mistreated when it comes to law. So now,
So you don't want just Philip Morris coming in and just getting all the business?
we want to make sure. So we have partnered because we don't have the expertise, but it's important that we partner. So we partner with a couple of high companies that are doing work across the country to come in and talk about how you get your license in Connecticut. So we're offering free sessions because we feel like people in our community need to benefit and be able to have an equal chance and have equity around it. So we're doing that. That's the whole month of March into April. We're having free sessions. We're also doing a lot of work, again, about refunding, so to make sure we can have more money for our down payment assistance program. That is a priority. We know that there's barriers, and the job of the NAACP is to remove the barriers. And we know that there's good, hardworking people, but because rents are so high, they don't have the money for down payments. And so that program we're going to continue to work on. We're also talking about expanding the vote in Connecticut. That's a priority for us. Voting, registering people, and educating them around the power of their vote is always a priority for the NAACP. But in Connecticut, we are far behind where we should be in a progressive state like Connecticut. So this year, we're focusing on expanding it, making it easier, talking about absentee ballots so that people in our community can vote and not have any barriers.
And early voting, like if they have two jobs.
Early voting. So that's one of our priorities this year. So we're talking about jobs, of course, not just for ex-offenders, but looking at the major companies who should be hiring more people that live right here in our community. So
and you've got some initial commitments from Yale New Haven. You're working on more.
Yes. Oh, absolutely.
So
Yale University, all the major companies, and holding our 5 universities accountable to make sure they continue hiring faculty, professors, workers, everybody at all levels, when these are all employers and they sit right here in our community. So we're still meeting with them. We're still pushing for that. So jobs, not just for ex-offenders, although that's a priority. And that's one of our main focus with the Million Jobs campaign. But that's not our only focus. Economics and making sure equity is the forefront for all the companies that sit right here in our community.
I wish I had time where you could talk about everything because you're burning with it. I love it. I love the fire. Keep going. Keep fighting.
Yes.
I hope you come back so we could talk more.
I will. Thank you for having me, Paul.
Do you want to give a last 20-second take on Ketanji Brown Jackson's nomination to the U.S. Supreme Court?
So we are supporting it. We are behind it 1,000%. It's about time. It's past due. We know that she has all the qualifications. We're excited. Not just because she's black, but that's important, right? But because she's the right person for these times, for somebody who we know can stand up and talk about this for years to come. She's a woman, right? So for all those
public
reasons,
defender, presidents aren't kings, as she wrote.
That's right. Oh, we're so excited. And we know that the time is now. The right time is now. And so the excitement is all over. I just came back from a convention and we're excited.
Okay, we got to get... Okay. Dori Dumas, President of Great New Haven, NAACP, 8 years and counting.
Yes.
Let's count for another 20 more, okay?
Okay, I don't know about all that, but thank you for having me.
And you'll come back. I love having you. I love the work you do, and keep it going.
Thank you.
Thanks for listening, folks, to Dateline New Haven. We're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It Would Feel to Be Free from the group CD A Plea for Peace. This is Paul Bass inviting you to fly free with us all day and all night on WNHH, New Haven's home for community radio.
So after a painful breakup, you pull yourself together for a day. Before you know it, you got 1, 2, 3, 4, 5 days. And each time you come face to face with an utter and complete stranger, the thought crossed your mind where there was one. Now there's you.
I'm a perv, baby, look through your peephole. Trying to get a kiss before I leave, do you think so? Maybe. You feeling me, girl, I'm feeling you. Don't tease me, I'm about to come through right now. I know you like it when I talk low, whispering in your ear. How can you say no? Just flow with it. Come on, baby, take your chance. Relax that right out some pants. Get that rid of an Indian doing the rain dance. Slide my fingertips up your blouse to get a glance. Nice and slow. I know you're not ready to go. You need to unwind, sip some more wine. Whatever, the red or the white kind. Staring in your eyes, trying to see into your mind. It's written, I got 2 more lines. Heart fluttering when I see you every time. It's like woo, 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 woo.
Hey, yo, you make me wanna.
Woo, 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 woo.
I just wanna.
Woo, 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 woo.
You make the brother be like, yo, woo, you like. I said,
woo, 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 woo.
hey, yo, you make me wanna.
Woo, 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 woo.
I just wanna.
Woo, 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 woo.
You make the brother be like.